Preparation for the surgical procedure. Prior to preparing the operating room for the first procedure of the day, you'll have already changed into your operating room attire, received your assignment, and washed your hands. When performing all tasks, use strategies to save time and reduce motion. Plan ahead so that the operating room furniture is positioned for efficient use and that the sterile field is established away from the door and heavy traffic areas. Upon entering the operating room, you should conduct a brief inventory to ensure that all necessary furniture is present. If a needed item is missing, you should retrieve it and place it in its proper location. A disinfectant wipe will be used to clean all horizontal surfaces. You should wear non-sterile gloves and work from the top of the operating room to the bottom and from the center to the periphery. Follow the same pattern every time so that you are sure to incorporate all areas in need of cleaning as part of your morning routine. An example of applying the concepts of time and motion economy is to position each piece of furniture as it is cleaned. Wiping down the operating room is only necessary prior to the first case of the day, and at some facilities, the routine may be altered, or ancillary staff members will perform this task prior to your arrival. After cleaning the operating room, remove the gloves using the technique that you've already learned, and wash your hands again. Obtain the surgeon's preference card and gather all of the necessary instruments, equipment, and supplies, or if the case has been prepared for you, locate the case cart and bring it to the operating room. Use the preference card to confirm the presence of all items. Items that are commonly used for all procedures, such as sterile water or saline, are not always listed on the preference card, but must be added from memory as part of your routine. If you are not already wearing a mask, one should be applied now. All team members entering the operating room from this point forward should be similarly attired. Be sure that the door to the operating room is closed before opening any sterile supplies. As you move each item from the case cart to the location where it will be placed, you should verify sterility, inspect the integrity of the outer wrapper, then remove and discard it, and confirm the integrity of the inner wrapper. The back table pack will be positioned on the back table, the basin set on the double ring stand, the instrument set on the single ring stand, and the gown for the surgical technologist on the Mayo stand. Any items that will not be opened immediately should remain on the case cart, or be placed in a location convenient for the circulator to access later. Begin opening the sterile supplies, starting with the back table pack.